just that you know, the Guernsey Drug Strategy group, the campaign, formed as a response to community talking about harms that are being caused by current drug policy. Okay, and it cultivates information, gathers information, reliable information to be able to share with people, and it's just a focal point for that. So we're volunteers, and they're people that do this because they have an interest in what harms and what helps the community. It links with social justice. So that would be who we are and what we're about. The question that we have is...
So there was a report released by HSC, produced by Professor Harry Sumner.
Yes.
And basically he looked at kind of where we are now in our drugs policy and potentially where we could go to. And our question is it's kind of twofold. Have you seen that? And if you have, what your views are of it?
I haven't seen it in detail, so I would like to, take the time to look into it, because I think it's such a important subject.
Sure.
So I have read it. I think it was very impressive and surprising, to be honest, for Guernsey, for me, kind of the steps forward towards the idea, particularly separating like the medicinal and the recreational sides of like cannabis in the way that we've got a social harm coming from our current drug strategy, in the way that we're treating drug users as criminals rather than the kind of using more of a like social work basis to deal with that. I thought it was really interesting. Like, it has been a little while since I've read that specifically.
It is a big report, right?
It's a long report. But yeah, no, I was like pleasantly surprised to see that actually coming out as an official document from the States, rather than kind of having it to be presented by the community who are looking to see change. But I was happy to see that we're kind of making those steps towards recategorising things and approaching drugs in a different way.
Any reports I've been told to sort of just wait until you find your seat and then start digging into things as they come up to debate, because you just can't absorb all of the information in one go.
It is a lot, yeah.
No, on my side, it's not an area I've got a particular interest in.
Well, what do I say? I'm sorry, guys, but we commissioned the report. Conscious that as HSC, we believe that we should have substance misuse or substance use, drug use put under our umbrella, because seeing it as a health issue, not a justice issue. So that was the first thing we did this term. And then we have done various things with cannabis, as you might know, in terms of moving to Schedule 2 and dealing with medicinal, and there's more stuff we're doing on that at the moment. And then we're tackling about what we can do around the interaction with justice policy. So that's why we commissioned the Sumner report. Personally, I think it is a good report. I don't know if anybody reads it. It's not judgmental. It's saying these are the things we need to look at, and also basically says it is a political decision. It's not at the end of the day. Yes, I've read up. I know about what's happening in Portugal and the effect of decriminalisation there. They come from a different perspective, and I think that there is also, in terms of supply, it's still criminal. It's a criminal offence to supply, and there are different levels on that. I do see the pros of decriminalisation of small amounts of cannabis. But the issue is not just cannabis, is it? It's all other drugs as well, which we need to look at. We shouldn't just look at cannabis in isolation. I know that's where the current campaign is on cannabis, but we do need to look at everything in the round, which is why we need to have the debate in the States. What we wanted to do this term was have to go out to consultation after the Sumner report to the public, and then have the debate of the substance use strategy. It was going to be about May, June, but then everything got in the way. And I know it always sounds like an excuse when we say it, but really honestly, we had Nikki and everybody all hands to the deck. So the next stage will be consultation with the public about what they think, and then then after that there will be the debate in the States. But personally, I'm really concerned with particularly youngsters getting a criminal offence. And cannabis. We've just been experimenting and also weighing up, well, what are the pros and cons of cannabis as well. So I do want that debate.
The demographic.
Yeah, I mean, I've always had a concern of sort of young people getting into drugs or drinking or alcohol, and you know, the kind of, we need to make sure that, especially in a small island, as we know, it's such a shame that we seem to be losing activities here. I remember as a child going to Beaujeu, we had the flumes and we've got, you know, Temple and bowling, and all these activities are disappearing. So, you know, you often find young adults have little to do, and so, you know, for me, so I fully appreciate where you come from. I mean, in my manifesto, made it clear we need a full justice review. Is that for us to start? Or
that was to start, yeah, sorry.
You just started I know everything about the report. So yeah, so saying in my manifesto, we need a full justice review. I mean, it's obviously a real shame the Home Department the last 4 years seem to be at odds and haven't been able to tackle some of these really crucial things that, you know, and when I was a deputy and I was in the States between 2012 and 2016, I was one of only about 11, 12 of us that actually went on the annual visit to the prison to actually talk to prison officers and the inmates to actually discuss some of the issues. You know, found a lot of, perhaps there are some good people getting in trouble for something that actually one could argue could be regulated, so people are actually safe to know what they're taking. At the moment, it's under the table.
Identifies that about half of our prison population at a cost of £44,000 a year, 2017 figures, are, so it's going to be more than that now, £44,000 a year for a prisoner, a majority for small amounts of cannabis.
I'm going to be honest, I haven't read it now.
I read it last night and I answered your email. So I've read it 3 times now, so quite in-depth report. It's a really good argument for things that we can do and improve on, and I thought I'd read it to refresh before I expanded on your 5 questions. I think there's a lot more we can do in 2020. There's the evidence to prove the fact that we haven't got the right policies in place. So hopefully when we go back to debate in probably mid-term next year, we can look at changing some of these and working collaboratively with you guys and using evidence from the report.
I'm going first this time. Of course I've read it. Health and Social Care obviously is the committee I'm on, and we obviously decided that it was really important to commission it to have a view of health and justice policy and to see how it all fits together. I think it's an excellent report. It sets the scene on how we can actually look at things in a very different light and bring the question of health into justice policy, which has frankly been missing before now. And I think it's so important to put those two hand in hand. We must support and protect vulnerable people, and that's the criminal justice system. But we also must take a reasonable approach with the way in which we sentence and the way in which we support. So yes, there is a lot in that report to read, and I'm sharing it with any candidate who wants it. So I think that's my moment.
I think I've read some of it, but I'm not entirely sure. I've been lost a little bit in
I'm sure you've had a lot to
the universe of state documentation. It's a journey. So, what I would say about this is that I've been talking to some people who have some actually medical issues, particularly surrounding the cannabis legislation aspect, and I do think Guernsey has some very strict laws on importation, particularly. I think decriminalisation could be a very interesting thing to do, not only on the health aspects and giving some dignity to some people who really need it, and also not to move too fast that actually we start creating some new issues that perhaps we don't have, and particularly maybe with people who are in a situation that we don't want to offer more opportunities to get things wrong, I think. Particularly around the, I suppose, I would advocate for perhaps use, but I think I would be in favour of trying to do that as a pilot project, maybe for a period of time, and look at how it was working, and we got it right without opening. And I know that Switzerland's legislators on there several times. It went to the floor a couple of times and was rejected several times as well about recreational use, although decriminalisation happened in 1998 or something like this. So I think our drug policy hasn't been changed since 1975.
Too long.
So I think, I think there has been some social changes that have happened since then. So we need to look at. Of course, we don't want to rush into it.
I personally haven't, but I've heard of it. What, could you give us a kind of précis of it, to just give us a flavour of what's in there? Because something concerns you, obviously.
Yeah, it was commissioned by HSC, Dr. Nicola Brun, I think, as well, to look at the current drugs policy, which is very much in the realm of law enforcement, and the fact that it should move to health, or it moved to health in 2017. That drug use, substance use, is a health issue, not a legal issue, not a criminal issue. The harms that are being caused to people that are being arrested, prosecuted, no job, no this, no that afterwards, or targeted by criminal fraternity as vulnerable people. So essentially, they're caught in a system of harm, of perpetuated harm.
So what you're saying basically, I mean, I used to work for the Home Department, so one of the places I worked was the prison, so I'm aware that sometimes around 60 to 65% of the people in there are in there for drug offences. And by that I mean some of them are in there for sort of major quantities of sort of hardcore stuff, and then other people are in there for quite small quantities, which really were obviously personal use. So I would agree with you that, and the report, which obviously I'm late to
digest,
but the sentencing does seem extremely harsh, and the punishments that, you know, if I haven't, but if I had a very small amount of blow in my pocket, to be honest, for my own personal consumption, the sort of devastating impact would be horrendous, because I could potentially lose my job, I could lose my home, I could be imprisoned, fined greatly, and probably never be able to travel to America or Australia, and places like that, where I would be treated as a felon. So I can appreciate that.
The summary report essentially provides you with the evidence for everything that you've just said. That is actually the current drugs policy causes more harm than it does good. If you're a substance user, you may need medical intervention, but you don't necessarily need a police officer.
I think that the police and the border agency do what they're told to do.
Absolutely.
They don't, you know, it's probably not a popular thing.
They'd probably be the first people to tell you that actually I'm not the most qualified person to be here.
I think it was Elliot Ness who was in charge of one of the organisations in America during the prohibition of alcohol, and he said as soon as they abolished that what's the first thing you're going to do is go and have a drink. So, you know, I don't think it's the law enforcement.
In terms of, I'm associated with the Guernsey Alliance Party, the Alliance Party Guernsey, and we've had many meetings, me and my colleagues, about this issue, and we've come to the conclusion that if we get elected, if I and my members get elected, or just a couple of us get elected, our remit is we're going to legalise medicinal cannabis for medical purposes.
It's already lawful.
It's already legal, but the legislation's not being enacted. So we'll make sure that that goes through. In terms of personal use cannabis, we're gonna. There are some of our members that wanted to legalise personal use cannabis, because in all honesty that seems like it may have been a vote winner for us. But in terms of what we've seen and the evidence that we've received, we will probably have a real meaningful investigation into personal use cannabis.
What evidence do you talk about?
So the evidence, as in, until the UK and Jersey support the legalisation of small cannabis, I've got an great authority in terms of what we've looked at and in terms of the investigations, that if Guernsey did go down this route, the UK and Jersey might blackball Guernsey.
Historically, yes. I mean, in Holland, for example, it's perfectly legal. You have cafes, and so to be honest, I'll have to get the name of the report and read it because I can't really.
As I was saying, I mean, recall the context when the report came out, and I've actually worked with Andrea Nightingale in one context because I, when I was deputy on Tindall for a while, sat on the addictions group. That was another niche, a gap, and now it's going to work in a wider context with Tracy Rear and as part of a bigger package. But I remember we did transfer it from home to health, and I think the team want that. But weirdly enough, when this report came out, we went straight into the education debate again, and then we went into lockdown and the funny environment politically, and then the election period was pending, and it got buried, and it never was properly debated. And I just did here, got the Justice Review, but we have issues on that, and we have many things. I walked for weed a few years ago. There was more teenagers and police officers and media than real people. It wasn't fashionable, but it wasn't a fashionable issue. It's fair to say at that point, or maybe people were a bit frightened to talk about it. I think now it has become a huge campaign issue. I remember too when the late Deputy Storey was Deputy Minister of Health, he said correctly that it was legal to have, in certain contexts, cannabis substances for medicinal use, but weirdly enough, it's very difficult to negotiate the implementation of that.
I can't claim I have seen it, no.
It's a lot to read, and you do know that, so.
I've seen it. I'm obviously current standing deputy and vice president of Home Affairs would be a bit remiss of me not to have read it. And also read that in conjunction with the Justice Review. I'm obviously always aware of my stance on this as we are. And Justice has been, this piece of work, our future justice strategy, that we've been collating for the last 4 years, is something that we can't just let sit on the shelf. Luckily, we've got timescales that the state's going to be bound to, with the successful searching from Emily McSwiggan.
No, I haven't had a chance to read it, I'm afraid.
I have, well, I've skimmed the Professor Sandal
It's a huge report, fully
It's a big report, yeah. And it was commissioned by HSC rather than Home Affairs.
Yes.
My views on the report then, for the large part, factually incorrect. And I don't know if you want me to go into my stance or not. So my stance on drug reform is that I don't support legalisation of recreational drug use at this time, but I do support a full review of the enforcement strategy that's going on, whether it needs to happen in the United States. I think, yes, Professor Sandal's report does give out some point of facts, but also we need to wait for the longer term trends from the US Canada, who just legalised cannabis, and actually see what happens in terms of health, crime, and also the economy, to see what the important factors are. We're only a small island, we don't want to move too fast. I think it's worth waiting a little extra bit to see what the actual long-term evidence is.
Okay, thanks.
I haven't read the report, but I have a good idea that what some of it contains, perhaps. And I certainly support the regulation of medicinal cannabis for medical purposes. And there has to be proper regulation though, and it has to be dealt with by the medical profession, the doctors. But that of course then makes, as we were talking about in another one, the cost of getting that, and
which is the social justice side,
which is a problem. But like Phil, I'm not prepared at this time, or I don't think ever actually, to legalise the recreational aspect of it.
Do you know what the evidence is for the harm that cannabis causes?
Yes, I do, and I have seen it, I'm afraid. This is why I'm so strongly against it. My evidence goes back some time, but one particular individual who is about the same age as my son has been incarcerated now in a secure psychiatric hospital because of what he had when he was in his 20s and so on.
Do you know what that was?
Sorry,
Do you know
cannabis.
what he had?
Yeah,
It was just cannabis.
It's only cannabis, yes. He'd grown up in a house, unfortunately, where the father, you could always smell it in the house. His father had tried to commit suicide, and he was a very bright lad, and he should have gone a long way, but unfortunately he went down that route, and it's very sad. But at that time, there was somebody doing a lot of drugs research in Southampton University, and my ex-husband was a friend of this lecturer, and we had a lot of information and so on, and it was quite useful for me to see the effect of various drugs.
So will you be campaigning that, will you take a stance against alcohol use as well?
Well, alcohol
and
and smoking are addictions too.
Yeah.
But and the evidence.
But they're legal.
They are. The evidence about addictions, of course, is that you cannot give them all up. You cannot say, right, I shall stop drinking and I shall stop smoking. That isn't possible. It isn't possible to do.
So what about those people who are using cannabis so they don't drink?
Well, as I say, for recreational purposes, I would prefer they have a short drink, as I do, a brief drink every now and again, just for enjoyment, not for any other reason.
Can I specifically come in just on the alcohol? I think it's looking at things in the balance or in the round rather. At the moment, yes, there is people who use cannabis the same way people use alcohol, but it's a much smaller percentage of the population.
You know about it a lot smaller because people are fighting.
Well, I choose that because alcohol is ingrained in our culture. It's accepted, and we can deal with that. There is support in place. There isn't the same support with cannabis. And my worry is, if we legalise it, would that give a big spike in demand? And then there's not the support.
That doesn't happen in areas where it has been legalised. That isn't the case. In a lot of areas, in Canada and things, it's become less cool to actually smoke marijuana. So
you then go on to something else?
no, it's not a gateway drug either. That's a real misconception. That alcohol is a gateway drug, if anything, really. So.
Sure.
Yeah.
Okay. Well, I'm disappointed that you're not talking facts, because it's absolutely untrue that we have people in prison for small amounts of cannabis. We don't have any. We haven't had any up to all of last year, and up to June this year. There was nobody in prison for small amount of cannabis.
Okay.
And the same,
Can you define small amount?
And the same as for community service. There's nobody on community service who's been put on community service for a small amount of cannabis.
Okay.
All of last year and up to June this year. So what you're informing candidates here isn't right. If you go back to Hansard, you'll hear that statement in the States as well. It's this myth that we've got a prison full of people with small amounts of cannabis.
This is Professor Sanders' report, not our.
You know, I'm just saying.
I'm just saying you haven't read the report.
Okay.
So
we're just going to show reports Transport Commission. If they actually go to the prison or Content Affairs, we can give them the
so
what's what.
my understanding was that the Home report, the Justice Review, and the Summer report went up to 2017. So why are you quoting current figures?
What you will see.
I asked. Sorry.
No, that's
why are you quoting current figures? Because with the Summer report and the Justice Review goes up to 2017.
Yeah.
So not interested in 1819. We're interested in the harm that's happened before that.
Prisoners that are actually there in prison.
Right.
Okay. I would rather be more up to date with knowing what's going on, because the law actually, the courts actually stopped sending people to prison quite a long time ago.
Okay.
Small amounts of cannabis. That was stopped. So you won't see that. You will find some in prison with the part of the charge is that if they kicked a policeman in the head and then arrested them, they found they'd actually got a small amount of cannabis. That is not the main charge that they go to court for.
Okay.
So they've had cannabis on them, or if there's been fraud, there are people in prison for fraud, And when they've actually gone to the house to do the raid, to take the computers and everything, they have found cannabis. That is not the reason that they were arrested and gone to court for. And that's a fact. You know, that is absolute accurate data. The ones that are in prison are the drug traffickers. And so they're the ones that we find in prison at this moment in time.
Like I said, the report we were talking about was up to 2017, which also reflects the data.
Well, I'll go first and be completely honest with you and say that I haven't read the report. I was actually out of the island back in February. It's usually I listen into States debates as part of my job, but I did miss that one. So I haven't read the report, but obviously happy to be pointed towards it and read it.
We did, is it yesterday we sent out an email? So obviously we're not expecting you to have read it since yesterday, because it's a big report, but it's just you have got an email from us with a link to it. So,
I will have a look at that.
It hasn't come to the States for discussion because it was a committee document, but it's meant to be coupled with a subsequent report on the use of drugs. Well, they really substance use, isn't it? Yes, substitute strategy. So the Justice Review came to the States, and it was rather a frustrating debate because it's a very broad review, but it was rather narrowed down to the subject of decriminalisation of cannabis, which meant that there was a lack of proper conversation and debate and question and challenge and consideration, wondering about what it could be that we need to look at in terms of the review in a sort of broader sense. And therefore, it became a technical debate, which was, I don't think anybody was satisfied by that. And the amendment to look at the narrow bit of the decriminalisation of cannabis meant that no one got a say about it. So I think that everyone was shortchanged, quite honestly, which is a real shame, because we certainly need a conversation.
I have had the opportunity to read it, but I haven't had the time to sit down and go through it yet. I am very... When I started writing my manifesto, I was planning a big push on medicinal cannabis in there, but things happened so quickly that it was really quickly overtaken. Really, the only thing you can offer on medicinal cannabis now is that it needs to be prescribed locally and it needs to be inexpensive and available to everybody whose symptoms will be alleviated by its use. And I think there is a justice change coming with regard to cannabis. I think it's inevitable. Look at Canada and America and the research that's being done there, and starting in Portugal 20 years ago. It's inevitable, and we should begin the conversation now to transition safely and agree on what such a new system is going to look like, and put the necessary safeguards in place. And I think it needs to be an island-wide discussion with everybody having their say to ensure that all voices are heard, all points of view are considered before we come to a decision on the way forward. But change is coming up, and I don't think we should put our heads in the sand about it. We should have a mature discussion and decide ahead of time what we're going to do.
Well, I think change is certainly coming, because nearly all, 70 or 90 or something candidates have sort of said that they're in favour of medicinal cannabis of some sort. So it looks like it's almost certain to have some sort of change.
Do what they say.
If people do what they say they're going to do, and there's sort of graduations on it, because I know that there's, because we currently have some legal THC, 3 milligram strength of use currently, and 0.3. Which is my units, right?
Which is not really enough in terms of THC.
Yeah, which is not really sort of useful enough as a medication. I think for sort of who would want to make use of really take it.
You were talking more about recreational there, weren't you?
We were talking about recreational as well. So, are you aware of the evidence of harm that is caused by cannabis?
Yes. Well, I've been following the David Nutt, saga since then. He still pops up in the public arena, but he did a very famous chart of harm versus addiction.
Yes.
And of course, it's no surprise to everybody in this room, I'm sure, that cannabis and LSD and ecstasy are down in the bottom left-hand corner, less harmful and less addictive than alcohol and tobacco.
You'd be pleased to know that the Stonewall report covers more than just cannabis. It covers other drugs, ecstasy and everything else as well, and they're talking about possession not being a problem. However, if you're going to possess it, who's going to supply it? proposal at this that has been that because you can't trust the importation, because you don't want people importing with a licence, and because you can't overcome all these governmental barriers at this stage, that we put an amnesty in place, certainly for cannabis to start with, and grow it locally. Have it as a business.
I read, what was it, last year, I think in Jersey, the economy was stating that it was going to grow the economy. Was it £300 million? I think that was the. And you know, obviously we've got all of the.
It's on the side of a bus as well.
COVID debt and everything else to think about, haven't we?
Yes, yeah, and we've got the greenhouses in place already. I've been looking into Canadian laws that you just mentioned, Scott, and you know, I think to have one possession on your body like 30 grams, I think it is of legal cannabis. I think, you know, you see in the paper over here that people are getting charged and getting criminal records for having a small amount of cannabis.
0.91 grams.
Yeah.
I mean, that's part of the debate about the difference between decriminalisation and legalisation. And the real advantage of legalisation or decriminalisation is you're breaking that link between criminal supply and users.
And then the problem with criminal supply, right, is criminals don't care how old they are.
Exactly, yeah. And that's how
we all know we have to keep cannabis out of the hands of kids, right?
Yeah, that's right, and that's how cannabis gets its reputation as a gateway drug and all these sorts of things. Because if your kids are experimenting, if they're buying it from criminals, then they're coming into contact with people who sell other substances. So breaking that link is really important.
People are addressing trauma at that particular point.
Yes, so that was
about health and justice.
Yeah, just before the just review.
Yeah. And if you have read it, what your views are. Now we do appreciate some of you may not have read it, and part of our kind of aim tonight is to highlight that report to you and urge you to read it. So don't feel it's such a question. I'm not going to forgive you for not reading it, but if you have, it'd be great to know what your views are.
Well, I think it makes a very
case.
Yes.
For drug reform.
Yes. And it lays the groundwork for the next bit of work that's supposed to happen.
So the next bit of work that's coming in is the substance use strategy, and it will inform that particular strategy. What we're concerned with as well at the moment is the fact that there is now evidence by virtue of that report in the public domain that the current drugs policy is harming your community rather than assisting them.
It's actually the most harmful part about.
The most harmful part about possession of drugs.
So it's actually harmful rather than not helpful.
Yeah, absolutely. So
when you think somebody is, getting caught in possession of a small amount of, ecstasy, cannabis, or anything else, and the Tindall report covers all drugs, not just cannabis. Okay, we have been campaigning quite hard for cannabis at the moment because there is no evidence at the moment that we can find that says that cannabis is causing harm. We've repeatedly called for it. We've not had anything to say what the harm is and what it ever was and why it ended up on the misuse of drugs list in the first place. However, we would support a level of regulation with it because there is not enough science at the moment to suggest that young minds are adequately able to manage cannabis at a young age because of developing minds.
Absolutely have to protect the children.
We do have to protect the children, and the main part of regulation is to protect the children. Equally road users and that as well, but that's already part of existing law that you cannot use any kind of substance and drive the car, even pharmaceuticals, even prescription drugs, and you'd be told every now and then you can't drive with these drugs or operate machinery with these drugs. So with that particular report, sorry.
No, I just not wanting to get bogged down in details, but I thought I'm not sure if the evidence is, but there are mental health effects associated with certain cannabis use.
Yeah, there are reports, and they are looking at whether that is young use, and that is where the evidence is missing. So to protect young people until that evidence is bottomed out, then that's what we're saying, to protect young people. I don't know whether it would be very much a political decision as to where you wanted to go with that, whether that was 21 or 18. But essentially, to protect them, we would be advocating for regulation. What we said is, with the Tindall report in evidence now and in the public domain, knowing the harms that are being caused, we've been calling for amnesty for the community to say we need to stop doing what we're doing because the evidence in the public domain is that actually this is harmful as a practice.
The amnesties around actually specifically focused at the moment around cannabis possession.
Is this the report that was saying it should be treated as health issues?
Yes.
Yes. I think we should follow what he said.
I've read a summary of the report. I haven't read the entire report.
Yes, it's 180 pages.
I had a lot of reading recently, but I have skimmed it. And but prior to that anyway, my view is very much that we shouldn't be treating most people who self-medicate do so for a reason.
Yes.
And it's usually either due to a health issue, mental health. I mean, I know people who are ADHD who self-medicate.
Yes.
So criminalising that just compounds the problems that lead them to self-medicate in the first place. So the self-medication, use of drugs is a health issue. It's not a criminal issue. Obviously, illegal supply is a criminal issue, but the user, the end user, why they're using is a health issue. And I think there's a criminal justice kind of white paper report sitting there that partial review that needs to be pushed at the priority to actually do a proper overall criminal justice.
That green paper needs to be put in the bin actually.
And
scrapped. It actually got voted down quite rightly. I've put the manifesto on to be on the Home Committee and look at that. My view is the whole of the justice, not just drugs, needs to be much more liberalised, much more.
Trust your community.
But for so many reasons. I mean, we're at the moment, if you look at the hot topic, which is, let's face it, cannabis, we're putting people in prison, costing a fortune for personal use. Now, I'm not going down I wouldn't legalise it as such, but because there's many options available. It's not legal, decriminalised, or
but it's about treating people with civility, not criminality.
And those with addictive behaviours, to use patients, those with mental illness, that's ultimately broadband, and they need the right support. And also, by putting the young people, by criminalising young people with a criminal record, therefore you've lost them. Their career is affected, certainly in Guernsey. Therefore, they're being a useful member of society can be affected. Their tax and social insurance, if you go down that path, is affected. So, for me, it's much more a case of the whole of the justice strategy, which includes addictive behaviours, including drugs, gambling, etc., etc. It's a liberal approach.
I haven't read the report, but I'm assuming that this is the one that's related to nice TAs and our prescribing.
It's more related to how the current drugs policy of arrest, charge, and blah, blah, is actually more harmful than the drug itself.
So, do you know?
Well, I thought I would just make sure I was onto the right topic. I mean, one of the things that becomes very clear very quickly is there is an equality issue here, and that's that those who have access to private medical health insurance have access to a completely different set of treatments. You just have to start by saying that's unfair and has to be rectified. And so the issue comes, I think the moral case doesn't have to be made. I struggle with anybody who didn't understand the moral case. So the question is, how do we get over the fiscal hurdle where people are saying this is going to cost us too much, and nobody's going to say to people with private medical insurance, we're going to stop you having the best possible treatment. What's been impressive is how powerful the voice from here has been in terms of actually promoting some of that change. I think this is driven from the third sector, but the third sector voice is strong enough to ensure that those people in the states who support it and who are willing to be a voice for you are not talking the wilderness. In the end, the states is held to account, even if you have to wait 4 years for that to happen all the time, is held to account by whether or not they're going to get public support by pushing through certain agendas. And agendas that have such moral power, and where all of us can see that could be me. I think.
It is about social justice at the end of the day.
Yes. But we're not allowed to use the word social justice. I mean, some of us do, but I mean, it's a very ineffective term to use in the States as it's been constituted in the last 8 years. Anyway.
So currently, with regards to drugs and what happens, the main one that I would actually point out is that short-term sentencing is one of the most detrimental things that we have. We imprison people for up to 6 months. The prison service has no opportunity in order to engage with anybody, so there's no reform of character that happens there. They're not given the time to do anything. Because it's a short-term offence, they don't fall into the probation service, which means that there's absolutely nothing that happens there. Generally, people who fall into that category then, they would have lost their job, they could have lost their home, they probably lost a relationship, they're actually in crisis, and then at that point, we're surprised that they actually fall into recidivism. By putting them in prison in the first place, we also put them in touch with other criminals. So the whole thing, sorry?
They're highly vulnerable.
Highly vulnerable. So I think the first one is that I had actually got it quite explicitly that we need a sentencing guidelines committee to be set up. I think that it's not just around drugs issues that we have serious problems about some of our sentencing. I've referred to domestic abuse as another one that's awful. So we need to have a sentencing guideline. Deputies have historically been very shy to do that, but this time I'm determined that we are going to actually start making inroads into it. It needs to remove short-term custodial sentences because there is absolutely no economic nor social nor justice involved in any of those, and we need to have the judges trained, which they're currently very unwilling to do, but by introducing a more neutral committee, I think you could actually get the justices to be, the judges to be on board with regards to more training in that regard.
So yes, so we've directed, the States have directed, that as soon as health and social care come back with that strategy for drug reform, when they come out with that within 6 months, another report will need to come forward in conjunction with Home Affairs to the justice policy. And I know about that because I wrote it. So.
What he states in there is the harm that's happening to the community at the moment. So how do you feel about an amnesty in the meantime? Because by the time we've got all these reports and everything, the harm is still being perpetuated.
So at the moment, I'm led to believe the police have the flexibility to act as they see, they believe is in the community's interest and the person's interest. So there's something called the separation of powers, where we legislature, deputies, discuss the policy, draft and enact laws, and the police are there to interpret and implement the laws. So if you're requesting an amnesty, then it's really the implementation, interpretation of those laws in the interim that could be used that way. But the legislature, so deputies, be very careful when they try to influence how law enforcement enact the laws that the deputies, the government has actually put in place. So that's a difficult question to ask a candidate, because I wouldn't want to step on the toes of how the police are interpreting and implementing current law. However, I have been proactive in doing this as a motivate as co-author to actually ensure the two reports are co-joined, so Home Affairs and Health, and then come back to the States in the time period of 6 months within the Health and Social Care Policy Paper. So I think I recognise it, because obviously we did do as a motivate, stop and direction motivate. So we have recognised it. And the state's majority recognised it.
Because while the police have, like you said, they've continued to take people to court for, possession of cannabis and
the police don't take people to court.
Sorry, the police prepare a report and give it to the law officers who decide if they're going to prosecute it. So, but the police tend to be that first part, they highlight what they find. So they highlight what they find, prepare the report, up it goes to the law officers, they decide if they're going to prosecute it, and now the judges, we're being told, are not, they're not putting people in prison, they're not getting community service. Where's the cost effectiveness in this?
I don't know, the question is, the police will investigate something if they feel it's in the benefit of the member of the community, the people in the household. Yes, okay.
So that's what they're doing. Yeah. There's a Crown Prosecution Service or equivalent of will determine whether or not it's in the community's interest to go down to court. Yeah. That is the judiciary. That's